Welcome to the Codecast podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the Codecast podcast today. My name is Terry Fletcher. This is a special bonus episode that I'm bringing you today to celebrate my 100th episode that actually dropped today. So I'm recording on the same day this will drop. You'll hear this come up on a Thursday, so of this week. But I wanted to celebrate by just doing a little bit of commentary. So it kind of involves coding more as to why you would be audited as a coder yourself, and some of the disconnect between various levels of staff involving both outpatient and inpatient coding, physicians, administrators, coders. And I just wanted to talk about that for a little bit, just so you can understand if anybody is policing your job or trying to figure out if you're the right person for that position, or if you're an administrator or you're somebody trying to hire staff for another position or for a physician. I just wanted to give you some insight on basically how to approach the topic, and hopefully you'll appreciate that in celebration again of our 100th episode. So today I like to call this, Can't We Just All Get Along? So for many years I've been surprised at the various levels of disagreements between staff involving both outpatient and inpatient coding in the physician and hospital settings. And depending on your organization and the role in this arena of being a healthcare professional, you may not even have had time to think about the word collaboration and on a coding level. So we're all probably very familiar with the definition of the word collaboration. It actually by definition means the action of working with someone to produce or create something. We may not be familiar, though, with the secondary definition that actually I found in the dictionary, and it says a traitorous cooperation with an enemy. And sometimes I feel that in the coding and billing, auditing and auditors and managers in that arena. That's kind of the sentiment sometimes that many coders feel about audits and auditors, but also how managers sometimes feel as well because of their need to direct the outflow or workflow of the coders, respond to upper management, and account for audit results. So sometimes there is a symbiosis fail here. What is meant to be a mutually beneficial relationship sometimes ends up being tragically complicated and sometimes can die over time because of one of the partners in this relationship is harmed or perceives harm while others benefit and grow. So coders as a product and coding as a product must be tested. There is no doubt about this, but your level of agreement with that statement may depend upon your desire to be agreeable or your capacity for growth in this area. No matter our age, we have periods of adjustment to how we relate to our work efforts being tested. Some individuals are more adept with their skill sets and productivity, quality, or both, which can make the playing field kind of unlevel for some and different for others. So let me provide an example. So years ago in the environment at one organization I was with, the coding staff were paid based on their productivity and quality. However, quality had really been a secondary concept, certainly not the hot topic that it is today. And human nature being what it is, with the desire to see dollars for work efforts, some employees cranked out hundreds of records a day with little thought paid to quality of their efforts. And this occurred with practically no consequences, or really so they thought. Other individuals of the same organization were able to perform even at 4 times that rate sometimes, coding as many as 500 encounters a day, but also had better quality on a continuous level. Most of those individuals were no nonsense in their approach. They were working with headphones on, never really talking to anybody, not taking any breaks, or really moving from their desk until they completed their desired quota for the day. When the compliance police came knocking and came in and took a look, the organization began to realize their need for good quality first in order to keep their clients and their monies gained through these efforts. But it was a little bit too late in some areas, and they received fines and penalties for the non-compliance. And they ended up with losses of clients, personnel, and company reputation also changed. So you can see from that story the need for coder testing in the form of quality and compliant training, and how productivity must become embedded within the process. Software enhancements, change, and a holistic approach to coding really has to happen. Similar examples in healthcare organizations across the country continue to emerge this day. That's why I have a job and I'm already booking into 2021. Probably not as extreme from a coding perspective, but they still occur. Nonetheless, and mainly from what I see, because of outsourcing billing and coding to an offshore company or simply not fully training your staff once you hire them. And seeing this trend over the years, that's where I became convinced that we not only need continuous policing in the form of auditing in our industry, and I'm not talking about micromanaging, I'm talking about better auditing, education, and a greater sense of professionalism. And here's some of the reasons why. The providers we code for, they've spent hundreds of thousands of dollars on their professional careers to become doctors, nurses, and licensed healthcare practitioners. The hospital organizations we serve, they want to provide the best care to patients in their communities and spend millions of dollars with minimal profit margins to continue to providing that care while also trying to remain competitive in their specialized lines of care to certain patient populations. These healthcare entities also are licensed and contracted with some oversight protocols and related to basic healthcare guidelines. And so they also have to have a greater need for quality and price transparency. And also, this seems obvious to me, but wouldn't those organizations and individuals that train professionals to become certified as coders want them to be the best coders they can be? All certifications and licenses now say professional on them, and I think we should live up to that moniker. So think of it this way, and this is something that I was trying to relate this to kind of a story that, or I guess I should say a parallel that happens in real life. And think of auditing and testing how you do your job in another way. So think about this. You're looking forward to your upcoming vacation. You've scheduled your travel, booking airfare ahead of time and arriving at the airport on the appropriate day to fly to your dream destination. You arrive at your gate and the gate attendant makes an announcement that the plane you're flying on has been having some mechanical issues with the engine, but it's being repaired. I don't know about you, but that always makes me nervous as much as I fly. After a delay, the attendant announces that all is well and boarding begins. So you take your seat and think nothing about it further. You trust that it's being handled and later take off and arrive at your destination safe and sound. But have you ever had the following thoughts? Boy, I hope they've tested the engine appropriately so it doesn't fail mid-flight. I hope the repair crew is properly trained to complete the repairs. And did the repair staff involved have a productivity goal to meet their work schedule today? Do they have personal certification? Are they also involved in continuous education? How much trust do the airlines have in them? And we didn't even think about it. We just got back on the plane and said, great. But you can see where I'm going with this hypothetical scenario. Testing an engine ensures that it can be trusted to function under the stresses placed upon it and within the parameters for which it was designed. Auditing your coding and billing staff involved in the job ensures that repairs are performed to the manufacturer's specifications, that workers have necessary skills to provide the service, and that they receive ongoing education related to all the design specifications for engines and when they're certified. So in the auditing role, I get to investigate all of the parties involved with patient care. I see the documentation issues that can appear and the need for improvement on all fronts, the need for process improvement change, sometimes my interactions with various staff members, hardware people, software systems, and the electronic medical record, IT department. Sometimes the encoding products are outdated and they're being used. And then my detective hat adjusts when I see things that are non-compliant and require appropriate communication to certain management executives. And of course, I'm gathering data to share with staff concerning my findings with the intent to encourage learning, teach a skill, point out areas of opportunity, highlight maybe some trends, and give kudos to those who are doing an outstanding job. I'm not there to take your job. I'm there to help you improve it, help see what you can do to succeed. But on occasion, the auditor, me, can be confronted with one set of unique challenges myself, which I have to face with politeness and respect and professionalism. Examples of this include the reason for the on-site visit for the review. I've showed up for on-site visits at hospitals and physicians' practices over the years, at times being met with surprise for my encroachment upon their territory, and have come face-to-face with the drama of office politics as well. Sometimes I was met with skepticism by physicians and board executives of hospital organizations saying, okay, let me see your findings and prove that this is accurate. And sometimes the details of my audit results, it offended some staff members. Physicians tend to be offended that I had the audacity to point out their copy and paste errors in the pre-EMR era of transcription and in our post-EMR era of all things being electronic. They're also often offended by my insight into government regulatory guidance in relationship to compliance. A lot of physicians will say, no, Medicare's just out to get me. They're really not. They're out to, again, police. I'm not saying Medicare doesn't have some funky rules, but they're really out there to try and not spend money that isn't warranted. Office staffers sometimes are offended by my presence because they had to pull records or provide access, set aside space for reviews, gather staff for meetings, and essentially let me look behind the curtain where things were hiding. And then executives sometimes could be offended by my directness. I don't hold anything back concerning the state of affairs within the organization, concerning the project I was hired to complete. And sometimes, which I found this kind of funny, they believed a good steak dinner would soothe the audit beast in me and would set up an evening to try and get me out to the local fair and, just make sure that I was wined and dined. Now, they have to have better wine to be able to prove that. And I'm kidding when I say that. But as professionals, we can't let offenses change our desire to help organizations and individuals be the best they can be for their clients, patient in need of health care. As auditors also face similar productivity challenges regarding my own work with organizations, occasionally trying to give me information that's cumbersome or clunky or isn't complete. And also when I'm dealing with things that are remote through their own software, trying to navigate their processes when I'm not familiar maybe with their software, and I know most of them. It's kind of interesting to just on my platform as well, make everybody happy. So now, as my capacity as a consultant for over 20 years now, my desire for testing and auditing is as strong as ever. And why is that? It's because I need great staff, which is you, to deliver a great product. The staff I work with deserve my best, and the clients I work with deserve the best staff. And again, that is you. So auditing and testing can promote informed decision-making for current staffing needs, appropriate career transitions for those currently within the organization. Maybe there's a person in coding that needs to be in medical records and vice versa. And acclimation for individuals who desire to, join the program. All the coders I work with desire education and training. They want to learn, they want to grow, and I want to see you succeed. So auditing helps keep you accomplished, test your capabilities, sets the bar just a little higher, and also shows you the need to stretch yourselves in your career. It allows us to all kind of look at our strengths and weaknesses for what they are and helps to formalize a plan to adjust and adapt. Of course, there are things that I try to monitor and things that are not seen from auditing and testing, because one of the other things I look for is, and I try to quantify this, work ethic, adjustment to company culture, as long as it's positive culture, remote work environment for those that are deserving of the opportunity, professionalism, and integrity. Some of these roles may be differently mandated, but my goals and directives are probably more symbiotic than we know. So the mission is probably identical in what you're also doing. Support the healthcare space. Ultimately, providers and organizations that provide patient care, they really want to do it with purpose and excellence. And that only starts with monitoring, policing, and making sure that we're also doing our job as well in a compliant way. The reason I wanted to bring up this topic today in celebration of my 100th episode is because I've done a couple of them now on professionalism. And this is an extension of that. And just understanding why everyone really needs to get along on the platform of healthcare professionals. Only because we all have the same purpose. And I'm seeing more and more mistakes made that just don't need to be made. One of the things I saw today was and the person who told me this, they're going to hear it on the podcast because she mentioned it, but without mentioning any names, she was told that by an ER physician staff member or I should say the company, that a physician in the ER can bill incident to, which is incorrect. I had another one today on a TB test for a return to the practice, and they wanted to know how come they're getting denials for a level 4 office visit. Most practices aren't even charging for a return TB test where the patient comes to the counter and says, how does my arm look? So some of these things where people have been told, yes, you can bill it this way or yes, you can't, That's all about policing. It's all about making sure that everybody knows the rules, everybody is understanding how things work, and that we're bringing that compliant, accurate information to our physicians, and that everybody hopefully is working together for the best product. So thanks for listening today. I hope you enjoyed the bonus episode of the Codecast podcast, and I'll talk to you all next week. Make it a great day. And thank you again for listening to the Codecast podcast.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter at TerryCoder1 or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.